right. Okay, good morning, doctors. Thank you for taking your time to attend this webinar today. And I would like to thank Hanoi Medical University for extending this invitation to us. It is really my pleasure to be here with all of you. And in this session, I will be sharing with you this new class of dental material called glass hybrid, which is going to be the future of restorative dentistry. Okay, so now with restorative dentistry, especially with direct restorative materials, right? There are generally three kinds of materials that we use. First, of course, we have amalgam, which has been around for 150 years. And then we have composites, and then we also have GIC, glass ionomer cement. It can be in its pure form, like pure GIC or a resin modified GIC. Now, our main goals as the clinicians in doing restoration is that first, we want to remove the disease and conserve the remaining structure, right? Because by doing so, we hope that we can prolong the survival of the tooth inside the mouth. But at the same time, we also want to choose the most optimum material to reduce the failure and reduce the repeat restoration cycle. But if we look at our materials here, we can't really achieve these objectives with amalgam because amalgam needs mechanical retention. So we need to create undercut and unnecessarily remove healthy tissue. And the second thing also, the biomechanics of amalgam doesn't match the tooth. So there is a higher risk of fracture in the future. That's why these days with modern dentistry, we either use composite or GIC, right? So let's take a look at our composites. Okay, composites these days they have been like developed so well. Like they're generally strong, they polish well, and have very good aesthetics. But being a resin material, right? There are some downsides with the composite material, such as we are always bound to have some degree of shrinkage because of the polymerization. Now, depending on how much the shrinkage is, this can put too much stress on the bonding interface and cause some issues such as a marginal leakage. And the degree of the polymerization shrinkage can also create stress inside the material itself, and that can increase the risk of the fracture. So to overcome this shrinkage issue, usually we need to apply it incrementally or in layers, which is sometimes not time efficient because it can take longer time, right? And of course, composite, if we want to put it inside the mouth, we must do it under good isolation, or otherwise our bonding can be compromised. So now let's take a look at the other material. What about GIC? Okay. GIC, generally speaking, it has many advantages that composite don't have. So for example, GIC releases fluoride. So that means when we have a deep cavity like this, we can be more conservative with our preparation. So we don't need to remove everything here, just remove the infected layer and then leave this affected layer or demineralized dentin behind. So we just place GIC on top because GIC will be able to remineralize this layer. So it will help with the hardening process of this layer. Second advantage, GIC is moisture tolerant. So it can be used when isolation is challenging, for example, with kids patients or with geriatric patients, old patients. And then GIC forms highly acid-resistant chemical seal. So the ionic exchange between GIC material and the tooth creates what's called calcium polycarboxylate salts. Now, what is interesting about this calcium polycarboxylate salt is that can be seen from this picture here. So this is a microscopic image of a GIC material and the interface between GIC and enamel. So this side is GIC, this side is enamel, and this is where they meet. If you look closely, there is actually a thin line running near the surface of enamel. So sometimes when GIC material fails, right, it is more of a cohesive failure rather than adhesive failure. What I mean is that when it fails, the material breaks away from the cavity, but the chemical bond stays behind. And the chemical bond is this calcium polycarboxylate salts. And since this is a highly acid resistant structure, so this actually forms a protective layer for the underlying tissue. So this is one of the main benefit that we can't get from composite. And then different from composite, GIC is regarded as the true bulk fill material because there's no limitation on how thick we can apply and cure the material because GIC cures on its own, right? And the shrinkage rate is also very, very low. So there's a very minimum stress on the bonding interface and surrounding tissue. So this also lowers the risk of marginal leakage. But the material itself is not without some disadvantages. We know that the aesthetic of GIC is not as good as composites. The material is more on the opaque side and of chalky color. And the usage is also quite limited to like smaller cavities. It's not really recommended to restore bigger cavities like class 2 because there is a higher risk of fracture of the material. And because of these disadvantages with GIC, GC had tried to develop a new class of material, which is called as glass hybrid. And this is the main topic of our webinar today. So if we talk about glass hybrid, then the history started all the way back in 2007 when GC launched Aqua. So it was the new generation of glass ionomer. So compared to conventional GIC, it had better like physical properties such as higher fracture toughness, higher flexural strength, as well as higher fatigue resistance. And this material had been featured in many independent scientific papers. So it does not only have 2 or 4 years clinical study, but actually a 10 years long follow-up study. So this is one of the longest studies ever done on one lentil materials. And of course, because of these studies, the material was well accepted by the clinicians. So for example, this is one of the study done by Griswold University, a 4-year evaluation comparing Aqua and conventional GIC on a total of 1,000 fillings. It showed that Aqua has lower failure rate at only 3% compared to conventional GIC. And this one other study by University in Turkey also shown that within a 6-year evaluation period, Aqua showed better retention rate than conventional GICs. Okay? But what is more interesting is that this 6-year evaluation study, it proved that Aqua has actually a similar clinically successful performance compared to composite restorations. So after the proven success with Aqua, GC kept refining the technology and then launched Aquaforte in 2015, which is now replaced by the newer version since middle of this year, and it's called Aquaforte HD. And this is where we started the use of glass hybrid technology with Aquaforte and the newest Aquaforte HD. So let me explain to you how this glass hybrid works. How is it different from GIC? So with GIC, we always have powder and liquid components, right? And the powder usually contains one type of glass filler. The liquid contains one type of acid. We mix this together, we get a GIC restorative material. But with glass hybrid, we don't only have two components here, but instead we have four components. Now, if we look closer to these four components, they actually consist of two types of glass. So one is larger sized glass particles, the other one is the smaller sized glass particles. And then it also contains two types of acids. So we have low molecular weight acid and high molecular weight acid. What is interesting is that high molecular weight acid is actually present together with the glass particles in anhydrous form. So this acid is in dry form. So these three components here make up the powder part, the powder component, and the liquid contains low molecular weight acid as well as water. So when they are mixed together, this water will activate this high molecular weight acid, and together they begin the chemical reaction. And because of the combinations of these four components, we can get a denser matrix, because as you can see here, the small particles are filling in the gaps between the big particles, and the combination of low and high molecular weight acid create more cross-linking within the matrix. And this is the reason why this glass hybrid material can give us three advantages that we can't get from GIC. First, it has outstanding aesthetics. As you can see, the color here is no longer as chalky as before, but it blends nicely to the surrounding tissue. Then it has exceptional strength and, of course, higher fluoride release. And this is not only a one-sided claim from the company, because we have many like third-party studies done on this material. So for example, this one, the strength of Aquaphotic HD. This is a 2 years study on clinical performance between Aquaphotic and nanohybrid resin composite in class 1 restoration. And it was found out that there were no significant differences in the survival rates between Aquaphotic restoration and composite restoration. And even for class 2 restorations, where many conventional GICs fail, there's no it was found out, or it was proven, that there is no significant differences between glass hybrid and resin composite. And in fact, Aquaphotic can be considered as permanent restorative materials for large class 2 cavities. Okay. And the higher fluoride release with this Aquaphotic is also highly beneficial in providing internal remineralization, or the hardening process of that demineralized dentin. So this study here proved that Aquaphotic actually showed the largest increase in radiopacity of the underlying demineralized dentin, which that means this Aquaphotic HD actually facilitates the higher degree of remineralization compared to other materials like calcium hydroxide, MTA, or something like bioactive composite. So let me take you through the newest member of this Aqua family, the Aquaphotic HD. So this is actually a hybrid restorative material in a capsule delivery system. What makes this Aquaphotic HD special compared to the older version is that now we have more of the smaller sized particles. If you see the older Aqua version has more uniform particles, but this one with Aquaphotic HD, we have more smaller sized particles, and these small particles are actually filling in the gaps between the bigger particles. That's why we get denser matrix. And that's the reason why we have higher physical properties. For example, the Flexural Strength, because this Aquaphotic HD has the newest glass hybrid technology. We can see that it has a much higher flexural strength compared to its predecessors. And in terms of compressive strength, we can also see there is actually a huge jump between the Aquaphotic HD and its predecessors, or the older version. Another improvement is also made on the aesthetic parts, because now the refractive index of the filler and the matrix in Aquaphotic HD are now more similar. So if you see it, we compare it side by side, you can see that the Aquaphotic HD is now a lot more translucent compared to the previous version. And this is why with more translucent material, we get better adaptation, or better adaptation to the natural color of the surrounding tissue. Now, one of the key points in glass hybrid technology also involves the usage of the coating agent. And this is the reason why Aquaphotic HD is recommended to be used together with Aquaphotic coat. So this Aquaphotic coat is actually a top coat. So it's placed on top of the restoration after we finish the procedure. So like we finish contouring, we finish the part adjustment, then we place this coating agent. So it's a self-adhesive nanofilled coating agent. And the purpose is to improve the wear resistance, increase the surface smoothness, as well as the aesthetics of the restoration. So it can provide like a glossy surface to this glass hybrid restoration. But the main function and the main benefit that this coating agent gives to our restoration is that it protects the restoration during maturation. So with GIC or glass hybrid material, once the material has set, there is actually a residual chemical reaction going inside the material until a few months later, and it reaches its maximum strength. So if we protect the material during this initial maturation period, then it can undergo proper maturation process and then reach its maximum strength. And this coating agent, this Aquaphotic coat, it doesn't just sit on top, but it actually trickles down and fill in the surface porosities. So it's kind of like providing reinforcement to this top layer, increasing the hardness, and then create a more uniform surface so it doesn't break easily. And this is why using Aquaphotic HD with the coat can increase the wear resistance significantly. So here in this chart, the lower the number is actually the better. We can see here with Aquaphotic HD together used with the coat, the wear resistance is much higher than the wear resistance of the material, restorative material alone. But of course, if you want to use Aquaphotic HD alone without the coat, you can do that. And it still has very good wear resistance compared to conventional GICs. But please remember that our goal as clinicians, we don't only want to fill in the cavity, right? But we also want to make sure that our restoration can last as long as possible so that we can reduce the repeat restoration cycle. So this is why we keep recommending doctors or clinicians to use the restorative material together with the coating agent. Now, one of the most often asked questions is that, will the coat wear off? Now, our study shows that the coat can remain inside the mouth for more than 6 months. But after it wears off, we don't need to reapply the coat, because by that time, when the restoration is exposed to the saliva, the restoration will undergo secondary maturation that further increases its hardness. So as you can see from the chart here, the orange line indicates the material that was placed inside saliva, but without coating agent. Of course, there's increase in the terms of the hardness of the material, but then afterwards, it just stays flat. It was going on stagnant. But it's very different to the material that was coated at the initial period. And then at some point here, the coat was removed because it was worn off, right? You can see after the coat was removed, there is a huge jump in the hardness of the material. And this is why the benefit of this coat is actually very significant, that in increasing the durability and the wear resistance of the restoration. Now, I'm going to show you the video on the manipulation of Aquaphotic HT and the usage of the coat as well. Oops.
This video shows the restoration of a class 2 cavity using the Aquaphotic HT. Place a sectional matrix and an anatomical wedge for better adaptation and to get good contact point. Apply cavity conditioner and leave for 10 seconds. Rinse thoroughly with water. Blot dry, do not desiccate. Shake the capsule, then depress plunger to activate it. Mix for 10 seconds. Next, remove the capsule and insert it into the GC capsule applier. Click twice to prime capsule, then syringe directly into the cavity prepared. Contour surface of the restoration, making sure to avoid moisture contamination or desiccation. Next, apply the Aquaphotic coat. Use dental floss to apply Aquaphotic coat on the proximal surface. Then light cure for 20 seconds.
All right. So with this newest version of Aquaphotic, the Aquaphotic HT, we will have an extra 15 seconds of the working time. But the total required time to finish the procedure remains the same. So it only takes us around 3 minutes to complete the restoration. Of course, we cannot achieve this with other material like composite. Yeah, composite will take much longer than 3 minutes. And this is a clinical example of the usage of Aquaphotic HT in deep class 2 cavity. Now, if you use Aquaphotic HT instead of composite in this kind of situation, it gives us some benefits, such as we don't have to worry about the moisture contamination in deep margin like this, which sometimes can be subgingival and difficult to isolate. And then second, we also don't have to worry about the polymerization shrinkage. Yeah, because this is also a true bulk fill materials like GIC. And yeah, it can be placed in bulk instead of incremental. Another clinical example, this is why Dr. Matteo Basso, one of our KOLs, so he used Aquaphotic HT as amalgam replacement material. So yeah, it's very good alternative for dentists who usually use amalgams, because we don't want to use amalgams anymore because of the toxicity issue of the amalgam. And this is the case of hypomineralized teeth. So in this kind of situations with hypomineralized teeth, if we restore this with composites, we might not be able to get good bonding because the enamel and dentin are hypomineralized, and we might also risk sensitivity in the patient as well. So in this case, we use Aquaphotic HT because it can bond chemically to the tooth and at the same time release enough fluoride to remineralize the surrounding tissue. Okay, now I would like to show you some tips that can increase your success rate with this glass hybrid restorative materials. First thing first, we need to keep in mind that we need to set our expectation right and respect the limitation of any dental materials. Because even with the strongest material, it